So what the Horizon 3 Biotech Fund is a unit trust designed to be $100 million. We're not quite halfway there in commitments, and it's an evergreen fund. And as you'll see as we go through, the idea is to de-risk our investments by investing at a later stage and also improving the lives of people globally is our main purpose. Important notice. And so I've mentioned that the purpose of this, the founders of the fund really did have a strong purpose in solving global challenges and applying leading edge technologies to those challenges. And so by using that as our purpose and a later stage strategy, investment strategy, which I'll explain later, we're very confident of achieving at least a 20% IRR per annum net to investors. So biotech, for those that don't realise, biotech is booming. It's an excellent sector to get into because we have ageing populations, we have increases in chronic diseases, we have IT that's improving some of the medical devices, and there's a real acquisition hunger from the larger pharmaceutical and medtech companies. So we really feel that if someone wanted to diversify their portfolio and include biotech or healthcare, this is a good way of doing it because it is a diversified fund, not only investing in Australia, but also investing internationally. So some of the indicators of how the sector is booming. This graph is over the last 10 years, and you can see that the S&P Biotech Select Index, industry index, has doubled the S&P 500. So it really has, and you can see in the last couple of years, just with pandemic, the increased focus on biotech, it's been enormous. Now,
maybe on that, just on that slide that you've just gone over, what I guess we often hear, even from professional investors, other fund managers, is, well, biotech is just too. I just don't have the skill set to be able to appropriately do due diligence on these companies and work out if they're good investments or not. What I guess is your position on that sort of departure point?
Well, most investors, fund managers, the better ones, avoid sectors that they don't understand. And that's perfectly, like I couldn't do real estate, I couldn't do mining or anything like that. I don't understand those sectors. I would say that's why we have set this fund up, and people that want to get into this sector by having a part of their portfolio in healthcare would be better advised to do it via people who do it day in, day out. We've all got friends who have had successes in stock picking, but if you're going to limit that to one or two, then it's a great deal of risk. Over a portfolio of 10, we would expect to get a great deal of success out of a handful of those, and not all of them will necessarily perform. So we don't know which ones they are at this stage, but that's diversification. And I'm sure your audience understands portfolio diversification.
Sure, gotcha.
So I suppose in the same theme, Warwick, it's not for the faint-hearted, this sector, because it is very technical, and I'll go through some of the technical areas later. So the volatility is typically high, but then the returns can also be high. But this is exactly an example of why it requires professional management as opposed to having a stab in the dark. Now, I've talked about some of the macro and industry tailwinds, and this is really what is driving the sector and why it is booming. And these areas is what keeps it exciting for us, and some of them are unique to the healthcare sector, but others sort of make sense for other industries as well. So the growth in the sector, this is a little bit old, this slide, 2016, but it was projected over the next 14 years, or up to 2030, to grow on average by 160% worldwide, very much driven by these larger economies that are becoming first world economies, or certainly have a large proportion of their population that have the ability to pay for medicines, and so they are demanding it. Indonesia's, China's, and India's are really driving the world growth of the sector, and our investments need to be relevant globally, not just in small subsections.